Welcome to the Navigating My Crazy podcast. I'm Shayla. Navigating My Crazy is a weekly podcast created for moms trying to balance life, family, purpose, and wanting to improve their mental wellness. Our goal is to inspire conversations necessary to end the stigma associated with mental health and the unrealistic societal expectations related to being a mom. But most importantly, to create a community so that no mom ever feels alone as we all navigate this crazy thing called life together. This episode is brought to you by Shayla Shaw Empowerment. In addition to hosting and producing this podcast, I am a certified empowerment coach for moms. Are you in need of support and accountability as you work to achieve personal and professional goals? Are you looking to enhance skills, resources, and the creativity needed to overcome depressive behaviors, preventing you from being present, thriving, and enjoying your family? Then you need an empowerment coach. If you have any questions or want to set up a consultation, email me via shayla@shaylashaw.com, or if you want to know more about me or my services, visit shaylashaw.com. Let's start this show. All right, so on this episode of the Navigating My Crazy podcast, we are discussing maternal mortalities in minority women. In my city, over the last 30 days or so, we have lost 2 moms. I do not have the specific details, but my heart truly hurts for these families. Louisiana is number 2 in maternal mortality. Black women are 2 to 6 times more likely to die than their non-Black counterparts during childbirth. These are statistics that my friend Brittany posted in her stat last week. And today, during one of my continuing education classes on maternal mental health by Postpartum Support International, more statistics and discussion on the disparity in treatment of minority mothers was discussed. So today on the show, I have Professor Brittany Lewis. She is a professor and traveling nurse, and labor and delivery is her passion. She works all things maternal health, antepartum, intrapartum, postpartum, and well baby nursery. There is nothing more exciting to Brittany than a healthy mom and a healthy baby. So Beautiful Birthing by Brittany is an initiative that she's looking to start based on a need that she sees for patient advocacy and lack of doulas in our area. Welcome to the show, Brittany.
Hello.
Thank you so much for coming. I was just so excited by the post that you made. The hair on the back of my neck stood up because it was something that I was discussing with my husband. Like, my heart was literally broken, and I could see that yours was too. It just really sparked a passion and a force inside of you. So we've been talking about doulas. So can you tell us more about doulas and how you feel like this would help?
Okay. So a doula is typically, I'll start off by saying a doula is actually a lay person, which I find is fascinating. A doula does not require a degree. You can go take a few classes, get a certification, and learn how to support mothers during their laboring process. Typically, the doula goes to a few prenatal visits. If mom is at home and she just has a few questions like, hey, I've had 2 contractions today, should I go to the hospital? Typically, the doula can tell her, well, no, you should stay at home, or maybe you should go in. They're not said medical professionals, but they are more so advocates. During labor and delivery, when a mom is in pain, she's very vulnerable. Her mindset may not be intact. She probably can't make those decisions for herself. She may have husband, family members, all of these people present with her, but typically the doula is the one that speaks up. The doula is the one who is her advocate, who is her voice.
That's very interesting. One of the things that we were discussing is the tragic losses of the mothers that we've recently had in our area. So what are some things that could cause us to lose a mom while she's giving birth or after she's had a baby?
The birthing process is very dynamic. There are a lot of factors that can play in. No 2 moms are going to have the same experience from antepartum all through postpartum. If you get 2 moms, you may even hear 3 different birthing stories.
Right.
Overall, my passion or my focus is to focus on the preventable component of maternal death. Typically, that's your hemorrhages, That is your patients who have preeclampsia or some type of underlying disorder or something that they've developed over the course of pregnancy that hasn't been properly treated, or they don't know the signs, they don't know what to look for. Thus, you have a bad outcome.
And so when you say preeclampsia, heard of it, but don't really know what it means. So exactly what does that mean?
So preeclampsia typically develops over time. Usually, if you look into sources, you'll see where it says about 20 weeks gestation when a mom is about 20 weeks. It's characterized by the high blood pressures, swelling, sudden weight gain. Sometimes there's visual changes, abdominal or epigastric pain, nausea, vomiting, along with other symptoms that a mom can't really tell at home, which is protein in her urine. She would have to go to a hospital or to the clinic to know that that's present. Preeclampsia untreated can progress to eclampsia, which is the seizure component. She can have a seizure, which could progress to other things, ultimately leading to death. So the thing with preeclampsia is early recognition, early diagnosis, and treatment.
Right. And so another thing we discussed is the disparity in treatment for minorities. What are some causes of the disparity on both sides, as far as like patient being advocates for themselves, and then also from the professional side in nursing and from doctors?
Okay. I'll go from the professional side first. In general, we know that African Americans are undertreated. That's just point blank period. African Americans are undertreated. African American women, a lot of times, if you look at the different studies, they don't feel welcomed. And that goes to a point that I have the healthcare providers just need to be self-aware of how they treat us. When we go into a hospital, if we have a question, my grandmother always said, no question is a dumb question. I have literally, as a nurse, seen an African-American woman ask a question and be insulted by their provider. At that point, the trust is broken. At that point, the mom no longer feels that she's comfortable to come out and ask different things. So therefore, she'll ignore some signs. Let's say she's having a horrible headache and she may feel like the doctor's going to tell her, oh, take Tylenol, you're going to be okay. So She's not going to report that. So then there's the undertreatment and the underreporting, which is not even a formula for success or a healthy mom at that point.
Right. And so that's, like you said, where a doula would help. You would feel more comfortable with someone you're comfortable with asking those questions, whereas somebody made you feel dumb for asking a question you're not going to ask again. That's
another valid point. Shockingly, just trying to do some research myself, I even saw studies that actually said the words, African Americans feel dumb, African Americans feel stupid, and that shocked me. You know, we want to think we live in a time and an era where race is not a factor. Mm-hmm. We want to think that the color of our skin does not matter. We want to think that we'll all get equal care no matter what.
Right.
That is not the case. We need to be realistic here, and we need to get to the root of the problem. Unfortunately, race is one of those factors in 2019. We're not too far over the hump. This can be turned around.
Absolutely. From a professor's standpoint, when you are teaching or when you're looking through literature, are there any things that are brought up during the learning process as a nurse? Of course, that's where you can speak from, that talks about these disparities?
Typically, you'll see that multiple gestation. So let's say if I'm pregnant with twins, if I have diabetes, if there's a family history of chronic hypertension, if I have a history of hypertension, obesity, and a high BMI is associated with preeclampsia as well. My overall take from all of this is that Louisiana is number 2. Mm-hmm. We're number 2, 2018 study. We're number 2 behind the state of Georgia. Louisiana's number 2. Of all of our maternal deaths reported in 2018, 45% were preventable.
Wow.
That's 45%.
When you say preventable, what does that mean?
Okay, preventable. So let's say if she has preeclampsia, textbook says up to 42 days, she could still have signs and symptoms and complications of preeclampsia. Let's say we have an African-American woman who goes home with her baby, comes back to the ER 6 days later with a headache. Just because it's just a headache and she's in the ER, she did not call her OB,
Right.
The ER staff, they don't know the severity of what's going on with her. So she's going to be low priority to ER. She's going to sit there. She's going to not be treated. Eventually, it's going to progress more and more and more. And by the time they do see her, it could possibly be too late. Things could change very rapidly, very rapidly. We may take this lightly. Some healthcare providers may just say, Tylenol, rest, take your blood pressure. If it's fine, then call us back or we'll see you in the office. But these things can progress so rapidly to where it's almost unbelievable. And I've seen it in practice. That's one component of it being preventable. Another is in a postpartum period or the immediate recovery period after delivery. If a mom is not getting, we do what we call fundal rubs to monitor bleeding. If she's not getting those fundal rubs every 15 minutes, let's say her heart rate goes up, her blood pressure goes down, but because no one is really paying attention to her, she's bleeding internally. But we didn't pay attention in time, so now that's another loss. One life is one too many.
I agree.
One is one too many. And that goes back to not just us as nurses. This goes to all healthcare professionals. Everyone needs to be passionate about this. Everyone needs to get on this. Everyone needs to care about this. It's not a thing of, it's just Black. It's a thing of these are the numbers. These are the facts. We need to change this.
Absolutely. I had my first two children when I was 18, 19 years old. Didn't have much information except for a couple of brochures that I got from going to the doctor's office. Didn't ask my mom a lot of questions. What are some ways to get education and information to younger moms who may not know that has these symptoms? But I think you said one of them was vomiting, being nauseated. That's one of the things that's associated with being pregnant. So what information, how do we get the right information to moms?
So I feel like it starts with community. Myself, of course, I reside in California right now, but Louisiana is my home. Mm-hmm. Just in trying to find the right resources, I saw like LA moms and healthy moms. I've even had a few moms to inbox me and I just let them know, I'm a resource for you. Go see your doctor. Go talk to your doctor. If your head is, and I always stress, speak, let your voice be heard. Trust yourself. Trust your intuition. You know your body. Do not take no for an answer. There can be a mutual relationship between a doctor and a patient where they don't agree, where you can demand that they do something for you.
Right.
Other resources, to be honest with you, Shayla, besides your OB, there aren't many resources out there. And that's where me and my team plan to make a difference. We want to start with community, start with some community resources, give especially teen moms a voice, because I was a teen mom. Labor and delivery is like my heart. That's my passion. And I feel like we're going to start small and we can go big.
So what are some things that a person should look for in an OB? Unfortunately, a lot of times when you don't have the money or insurance to afford, then you're usually assigned an OB. But what are some things that you should look for or questions that you should ask when you are trying to find your doctor or your nurse?
I'm going to quote one of my good friends. She's like a mentor to me, Toya Kelly. Toya always says, you cannot be passionate about someone that you can't really relate to. Mm-hmm. Now, am I saying that a white OB is not capable of taking care of an African-American patient? That's not what I'm saying at all. There's no racial slur there. But I also feel like I want someone who can relate to me. Mm-hmm. I want to always be that relatable nurse to all my patients, not to just my Black patients, but I want to be able to relate. I want to open door. Now, of course, they still have lives too. So when I say open door, you're not going to be able to call and text them every little thing.
Right.
But you want to know, do they have like a helpline? Do they have answering service? Can I call and leave a message? What's their reliability? Are they going to get back to me? And you can even go in this technology-driven world.
Right.
From what I hear, you can Yelp a doctor.
Yeah.
Personally, I've never done it, but I haven't worked with every OB in Northeast Louisiana, of course, but I have worked with some really awesome OBs. We have the doctors there. We have the talent there. We have the compassion there.
Absolutely. And so what are things that you can do during prenatal? We talked about like prenatal yoga, things that we hear a lot about or see on TV, especially here in our city. I think maybe at the wellness clinic in West Monroe, they have things like that, but it's not well advertised. What are just some resources that many people don't know about, but that are beneficial for a mom during pregnancy that maybe she should seek out or research?
Like I said, and I'm going to always, I think, go back to the teenage mother. We do have a lot of teenage pregnancy in Northeast Louisiana.
Mm-hmm.
I learned that when I came to California, because in California, most of my patients are 40 plus. And I'm like, they're kind of advanced maternal age here. One of the things that young moms or all moms should start looking into. There's nothing wrong with centering classes, any type of birthing class, even if you don't have a partner. I know me personally, when I was 19 and pregnant, I didn't want to go to a birthing class because my child's father was out playing football. I didn't want to be seen as this young teenage,
Mm-hmm.
the negative stigma of teenage pregnancy. Her baby daddy is not here, or
Right.
the
Mm-hmm.
child's father, for the lack of better terms. But take your best friend with you.
Right.
Take your aunt with you. Just anyone who cares about you and will support you. Take them with you. Go to a birthing class. Do you some prenatal yoga. Go get you a prenatal massage. De-stress. The typical prenatal things that we need to do is not just for us. It's all the way across the board. Your folic acid, your prenatal vitamins, your healthy diet. That's a big thing for African Americans because obesity is rampant in our community. I don't like I'm not going to really call it negative, but you don't really hear about African American women, especially low socioeconomic status, going to a prenatal yoga.
Right.
You don't hear about us going to the chiropractor to get alignment.
Right.
You don't hear about us going to all of the birthing classes. And we should, because you need the support, you need the resources. I know here in California, you go to a birthing class, you have about 5 or 6 doulas lined out willing to even volunteer for you. Volunteer doulas here. And even if you feel like, I don't know that person or they don't know anything about me, that's what the pregnancy is for. Develop the relationship. It starts in the prenatal, from like your first prenatal visit. You can start developing that relationship with your doula. Have a birth plan. You can always write out a birth plan that basically says, I want this, I want that. I want to try to go natural. If I cannot go natural, I'll say this, I'll do this, I'll let you know this. I want my mom in the room. I want my dad outside the room. I want the father of the baby to cut the cord. Write a birth plan.
Wow.
We get on social media, we can type a status, you can type a birth plan.
Right. That's good. I never even thought about a birth plan. So you named a couple of things, but what should be included in a birth plan? If, okay, I find out I'm pregnant, that would be an opportunity, of course, to kind of start with your desires. And then, of course, later on, as you progress, you understand what those needs are. But what would be included in a birth plan?
A birth plan is actually an awesome tool because if I come in and I'm in pain, I'm rampant and I'm raging, I can't verbalize what I want, but I can snatch my birth plan out of my bag that I packed and I can give it to you. Typically on the birth plan, it tells who your support person is. It tells what's your plan of labor. Do you plan on going natural? Do you want IV pain medication? Would you like to use nitrous oxide? Would you like an epidural? At what point would you like to know this? For the natural patients, they can write on there, I don't want to know my dilation. Don't tell me my dilation, because they like to focus and try to get through the pain, so they don't like to be updated. You can say, I want my baby to have these vaccines. I want skin to skin. I am exclusively breastfeeding. I want formula. Don't offer me breastfeeding. I'm not interested. Everything you want can be listed on that sheet of paper. And a birth plan can be typed as early as, I'm going to say 2 days pregnant. And that's an exaggeration. But you can write your birth plan and have it and give a copy to your healthcare provider. Also bring copies with you to the hospital. A birth plan is also good too if you end up at a hospital where your OB is not. Mm-hmm. So I went out of town somewhere and my water broke. Here's my birth plan.
Mm-hmm. That's awesome. That's a really awesome idea. And then another thing that we discussed earlier was having a list of questions as things happen, writing them out so that when you go to your doctor's appointment, sometimes, of course, you forget things that have happened during the course of the month before you went and saw your doctor. So also listing out symptoms or any information that you want to discuss on your next doctor's visits, any symptoms or anything that you find off. Because a lot of times going to the doctor, you feel rushed. You go in the doctor's office and there are like 16 other pregnant women and you're in and you're out. And sometimes you feel rushed. So when they're asking, is anything, you're trying to come up with some of the things off the top of your head. So one of the suggestions that the nurse on the call talked about was from the date of your last visit until the date of your next visit, you need to write out or list any questions that you may have, any changes that you've seen. Like you said, if you had a headache for 4 days out of the 30, those are things that you you need to talk to your doctor about.
Yeah, that is a really great idea, especially if you're having some type of symptom. If, let's say, you went to the doctor last time, your blood pressure was slightly high, but not high enough for them to call you preeclampsia, then at that point, you need to get a diary. Write down everything you're eating each day. Write down your physical activity, because you may go to the doctor and your feet are swollen, but yet you walked 4 hours that day. You wore unsupportive shoes. So I think that's an awesome idea to write down everything, write down your symptoms. Therefore, your doctor can sit with you and say, hey, I see you've had a headache for the last 5 days. You took Tylenol, it's not working. And then they can go to the next step. Have you had any visual disturbances? Any of this, any of that? Okay, let's work you up for this. You can be proactive in the process as well.
One of the things that you talked about earlier was even after the baby, there are still opportunities for preeclampsia or things like that to continue. Mm-hmm. How far after having a baby should you still be in contact with your OB?
Here's the thing, and depending on what's going on with you, remember I said every patient, every situation is different. I guess the takeaway from here is that preeclampsia and those symptoms and all of the things that could go bad with preeclampsia could happen up to 42 days postpartum. So that's 42 days. During that time, you still need to be watchful. A lot of times, young women, we want to go out. We want to show off our baby. We want to do this. We don't have the support. We want to run around. Your body needs time to restore. Your body needs time to heal. As we would say back in my day, the shake back is real. The shake back is not that real. Right. You need to rest. You need to recover. And if there's any signs or symptoms, you need to be in communication with your OB immediately. It's not to be taken lightly. There are women who lose their lives after having their babies. There are babies who will never know their mother, moms who never saw their baby. That's not acceptable.
Right.
Listen to your body, know yourself, and do the right thing. I mean, other things can wait. Life is just a little too precious for us to ignore these things.
Absolutely. Because one of the statistics that we were talking about was mental health and maternal mental health, even postpartum. We talk about 6 to 8 weeks after you have the baby blues and that time period to get over it. But most of the statistics show that postpartum can last up to a year after having a baby. So if you're experiencing symptoms, you're just not feeling yourself and it continues, you still should be in contact with your doctor. It's still related to things that are happening to your body, because some people's bodies, mentally, physically, hormones, chemical imbalances in the brain, those things take time. And everybody's time period is not the same. Some people, it does take a week. Some may take 6 weeks. Some may take 6 months, and some may take a year. But you have to be your own advocate and speak up for yourself.
I totally agree. I mean, even if, because I've had patients come into the hospital and I'll tell them this can happen up to a year, and they'll tell me, well, you know, last time I had these symptoms, but I called my OB and they told me to just kind of cope through it myself. And I like to tell people often, your OB isn't your only resource when you think you're going through postpartum depression. This, of course, not saying one situation is more important than the other, but if an OB is on the phone with you, you're telling them you're having postpartum depression signs and symptoms, but they're going to emergency C-section, what do you think the priority is? Right. So if they can't get you, or if you're not being supported by them, reach out to other moms in the community. Like I said, social media is everything in 2019. Go find you a group of moms that are experiencing these things. Call your local health unit or call and get you the different resources. Even if you have to call a psychiatrist. Call a psychiatrist. Call a counselor. There are plenty mental health counselors in Monroe, Louisiana that don't mind helping.
Absolutely.
So find you somebody. Get your hands on somebody. Don't go through this alone. Don't suffer alone. Crazy. You're not losing it. It happens.
Absolutely. And so the initiative, Beautiful Birthing by Brittany, I know you said that as you're trying to research and as you're reaching out for resources, you are finding that there are not many. So what are some roadblocks that you've run into as you really trying to start on this journey?
Yeah. Even when I wanted to start Beautiful Birthing by Brittany, even after I posted the status on Facebook and got with the group of women that I got with, we're finding different places that we think we can find resources, and there aren't many. There's no initiative, there's no resource in Northeast Louisiana, to my knowledge. If I am wrong, I would love for someone to enlighten me, that caters to the African American woman. I could not find anything. Like I said, I could be wrong. I don't know everything. But if there is something, I would love to know. I would love to do work. We would all love to do work. We are all trying to do work. As small as community, as big as legislation, and making some new laws and putting the initiatives out there.
You kind of talked about your journey when we were talking earlier, how that was your dream initially, but as you got into your career in nursing, you put it on the back burner. So let's just talk a little bit about you and this journey of yours, because I knew Brittany when she started nursing school. So I'm like so proud of you.
Oh my God.
Brittany the professor, and Brittany the traveling nurse, and Brittany in Dubai. But let's just talk about this journey of yours and how it's transitioned, and then again coming back to circle where you initially had this passion for getting information and really helping people. So tell me about your journey.
Initially, right out of nursing school, I had this big plan. I said, okay, I'm going to graduate nursing school. I'm going to go work the floor for a year, and I'm going to go back to school to be a midwife. As you can see, that never happened. I got in labor and delivery and kind of got stuck in labor and delivery, which is a good thing. I love labor and delivery, bringing life. Of course, we have our bad moments sometimes, but the bad moments humble you. It helps you appreciate life a little more. You realize like you have to be strong at this moment to comfort this mom who lost her baby. You find like your inner strength in labor and delivery. So initially that whole midwifery dream, I kind of swept it under the rug. In my mind, I was going to open, this big birthing center where women could come and deliver naturally, geared toward just the African American community. I kind of let that go, sunk into my labor and delivery, started teaching, got comfortable in California. Then some of my friends just started sending me screenshots like, did you know this happened? Did you know that happened? And I'm like, wait, this is heavy. Like, this is heavy. And I was texting my friends, like, to the point where some of my best friends were like texting me, checking on me, because I'm like, I almost felt guilty because I remember talking to one of the young ladies saying, I'll come and do some doula services for you. So that was really heavy for me, like really, really heavy. So after this, I said, I talked to, he's my cousin. I'm calling him my Uncle Roosevelt. He is like a light in my life. He kind of pushes and motivates me. So I was telling him, I'm like, this is so heavy on me. I feel like I have to do something. His exact words were, God's shown you the world. You've traveled the world. I'm ready for you to become who you're really supposed to become. Basically just telling me like, you need to go. You need to push. This is your sign. So in light of everything that's happened in my home, my own community, little bitty Monroe, Louisiana, I've gotten that push or that wake-up call again to go out and do the things that I need to do. Am I going to become a midwife? Probably not. Mm-hmm. But I am going to become an advocate. I do want to be the voice for African American women, and not just African American women. I feel like I'm the voice for all of my patients. I'll be the voice for anybody. And initially, I didn't want to share this. I didn't want to talk about this. I talked to like some of my coworkers here. I don't want to be deemed like racist. I don't want to be seen in a negative manner, because I have so many patients who love me, like follow me on Facebook. We talk, they send me baby pictures. I was like, I don't want anybody to read this status and be uncomfortable with me. Talking to my coworkers, we are like just sitting there crying together, sitting at the nursing station. They're like, no, you should say something. And I'm like, okay. So again, that was that push again. I'm like, you know what? This is it. I got my phone, of course, handy dandy Facebook. You want to get some information out? You want to spread it fast? Facebook, Absolutely. Instagram, Snapchat. That was my first target. Then some more Facebook friends inboxed me. We were going to start trying to work out how can we save these moms. We're just shooting ideas to each other. We're going to start meeting monthly. And then you came and approached me, and I was like, wow, okay, guy, this is good. And that's why I said, thank you for being the vehicle to getting my voice out. I can type a status all day long. I can go live. But once again, you were like my vehicle. I mean, I didn't need gas. I didn't need heat.
You said something that I remember saying to myself. Like you were saying, this just is so much bigger than me. And I would say the same thing. I know what I experienced, and I know what I hear these other moms that I was mentoring at the time going through. I can help these 5 people. I can help these 6 people. I can help 10 or 20 people, but I can't help the world. But what thing can I do to be the change that I want to see? And when you said, well, this is so much bigger than me, but what is that little ripple that you can push in the water to make the wave? And I know this is the exact thing that's going to make the wave, because you are a leader. You have this light. You have this thing that draws people in. And Beautiful Birthing by Brittany is going to be a thing that inspires somebody else to say, hey, I heard you talking about a doula. How can I become one? Or I'm pregnant and I've been feeling this. How do I explain this to my doctor? Or what are the words that I can use to maybe get the help that I need? Helping somebody's spouse or somebody's parent get the help that they need. I already know this is going to help. Just your status helped people. So just imagine, what this bigger ripple is going to become. I'm excited.
I'm excited about this as well. And I do not take it lightly. Even if one person listened to this podcast and say, hey, I had a headache and I told my OB and I went in and I had preeclampsia. I'm satisfied with that, because just as I said, one life lost is one too many, and that we saved is enough.
So if somebody hears this and actually knows of resources or knows of information that they want to get to you, what's the best way to get the information to you?
Facebook. You can inbox me on Facebook. My Facebook is public. I am Brittany Chocolate Doll Lewis. Please ignore the unprofessional middle name. It's my mom's nickname for me. I can't let it go.
Beautiful. Absolutely.
But yes, please inbox me on Facebook. I'll shoot you my email. We can do some messaging on Facebook. You can have my personal number. You can FaceTime me. I have over 200 students over the years who have my number. So if I can survive them, I can survive a few calls.
Right. And I'll be sure to post your information in the show notes. Thank you so much for jumping on and sharing this information. This is going to be big, and I'm so proud of you.
Thank you, Shayla.
No problem. Thank you for coming.
Thank you for having me.
Thank you for listening to the Navigating My Crazy podcast. Don't forget to send all of your questions to questionswithans@navigatingmycrazy.com, or you can complete the form on our website at navigatingmycrazy.com/contact. Also, join the community and chime in on the conversations by liking and following Navigating My Crazy on Instagram, Facebook, and Twitter. Subscribe and rate us 5 stars on iTunes or your favorite podcasting platform. Moms, have a great week and get ready for our next Talk It Out Tuesday.